Before I introduce our panel, I just want to mention a couple of statistics, and I'm sure many of you are familiar with these, but I think that they bear repeating. And so just doing a little bit of checking, the prevalence of mental illness in our country today, at least 24.5 million Americans are suffering from some sort of mental illness or addiction. 6.2 million children and youth. That's an incredible impact on our next generation. And speaking of youth, 8% of youth in this country have indicated that just in the past 12 months, they have contemplated or attempted suicide. Speaking of suicide, it's the number 11 killer in our country, 30,000 deaths each year. And I would suggest that many of those are certainly preventable deaths and unnecessary. And finally, if you're an employer, if you think about the economy, mental health and addiction, the toll is probably around $34 billion, that's B with a boy, in direct and indirect costs. And you certainly know subjects like absenteeism, a worker's ability to focus on their job and really be present and engaged, is also an incredible economic drain on our entire society, and we're losing some of their best contributions. So those are just a couple of the little data points that infuse so much of today's conversation, I think. I'm very excited with the panel that we have here today, and I'm going to just tell you a tiny bit about each of them, although I think you probably know most of them yourselves in this field. And I think that the diversity of this panel really speaks to how broad the impact of mental health and addiction is in our society. You know, there was a time not long ago when maybe we'd have a conference like this and you'd have a psychiatrist, you know, maybe a social worker, but those would be the quote unquote experts. And now what you're going to see are experts coming at this challenge from a number of different perspectives and sort of sharing that with you so that everyone begins to see really the broadness of this topic, both the broadness of the challenge that we face, but also places where we can tap into support and opportunities to really make some progress going forward. So let me just tell you a little bit about immediately to my left, Paul Dillon is a decorated Vietnam veteran. He's also the CEO of Dillon Consulting. And I think most interestingly of all, Paul was the creator of a really neat concept, a veteran startup incubator. And so Paul's going to be able to share with us so much of the veteran experience when it comes to addiction and mental health. I spent 25 years as a journalist, and I covered Senator Edward Kennedy for decades. And I started when I was 10. And so it's really a special treat for me to get to introduce another Senator Edward Kennedy, Connecticut State House, elected in November. But of course, Teddy, and I'm going to drop all the fancy titles after this because we're going to make this a conversation. So I